there is an area where most of us patients have a little confusion and sometimes even a little mistrust to the dentist. See whether you can put some clarity on it. When we have a missing tooth, and I'm talking about a missing tooth in the back, kind of, because in the front, yeah, we go to a dentist very fast. It's ugly. Back, not so much. So here we are having a missing tooth or two or more in the back, and really, yeah, not so much happens. It's okay. After a few weeks, we get used to it. You can see I had some, otherwise I wouldn't know. Nothing really is happening. Then we go to a dentist and he goes, you got to replace that missing tooth, otherwise all hell will break loose. What is that all hell? How come there's this different perception? How come sometimes we feel like this is just a money matter? It's a matter of having a Ferrari versus a Volkswagen, and frankly, let me have my Volkswagen if I like it. You see what I'm saying? Shed some light on it.
Well, the human is very adaptable. You can certainly lose 2 teeth and still get through most of your steaks and most of your meals. You could actually even lose more than that. I have more than one patient that's come to my practice with just front upper teeth and front back teeth, and they're still chewing and still need to lose a couple of pounds. But what is really happening is the following. If you lose a tooth, you have teeth adjacent to it. Those teeth will begin to move. Every tooth is really designed to be leaning up against another tooth. They need to feel something next to them. If there isn't, there's natural forces in the mouth. You remember, your lips are pushing in on your teeth. Your tongue is pushing out on your teeth and forward on your teeth. And there are continuous forces in your mouth that will then cause the teeth many times the teeth behind them to start tilting and drifting forward and creating spaces, and then opposing teeth who were touching the missing teeth are now not touching, and they tend to what's called super erupt. They start to look for their friend that used to touch, and then they come out of alignment. So your teeth all begin to drift. Okay.
A little bit like a fence, a little bit like an old fence, which it starts playing piano. It just goes left, right. It looks ugly, and at the same time loses the function.
Well, for now, ugliness is in the eye of the beholder. The beholder, correct? Ugliness is in the eye of the beholder. So let's for now not even talk about the aesthetic aspect. Let's just talk about the functional, structural aspect that happens to the teeth. So the teeth start to drift. The opposing teeth start to look for the missing tooth, so they come out of the arch. The adjacent teeth start to drift sideways, trying to close the space of the missing tooth. This will then, in many cases, increase the speed with which you potentially could lose other teeth that start leaning downwards and to try filling that space. Then you end up losing other teeth. That's a very real possibility. If you lose enough teeth, or if you lose, even if you just lost, let's use your example, 2 teeth. Let's say you lost 2 teeth on the lower left side. You're going to be doing naturally moving your food to the right side of your mouth where you have dentition. Well, you're now going to be pounding the right side, stressing those teeth, because now those teeth, instead of doing 50% of all the chewing, they're doing 100% of all the chewing. You accelerate the chances that one or more of those will break, will have a filling that needs to be replaced. So you get the picture. And then, of course, if you lose the posterior teeth, the more posterior teeth you lose, the more you change the way you chew and you bring the food forward. And as you bring the food forward, instead of using your front teeth to what's called incise, that's just, for instance, you use your incisors to cut through an apple. You understand?
Yeah.
You use your back teeth to chew. Now, if you don't have back teeth or less back teeth, you're using your incisors to smash. So what people do, instead of just using the front teeth to incise, they're now using the front teeth to smash, and that dramatically accelerates their death of the front teeth. So if you lose your back teeth, do not replace them. You speed up the dominoes, the falling of the dominoes. And it doesn't happen right away. It can happen over years. It may happen over a decade. But you may find that 10, 15 years later, you've lost a huge number of teeth and you don't know why. But this is why. It's a physics of force distribution.
So let me ask you. I mean, I come from an engineering field, of mechanics. And when you have one hinge which is always used and another not, or one cogwheel which is out of wacko, pretty soon the machine comes to a grinding halt. Now, from what you explained here, misuse, there are hinges. In fact, I've heard that the hinge, I guess you call it TMJ, don't make me pronouncing the big real word, but there's hinges. I heard that they are one or the most complicated hinge in the body. So are they affected by this also, and then create, as hinges when they're affected usually do, other bodily problem?
Yes, absolutely. The TMJ, temporomandibular joint, TMJ joint, is very important. It's an integral part of mastication. Our mandible, which is your jaw, is attached to the skull via this joint. And if you are missing teeth, you do increase the chances that you may have a TMJ-related joint problem. And we'd like to avoid that at all costs.
And that TMJ-related problem, explain a little bit where that goes, because I've heard it goes into, and you tell me whether this is true or not at all, I've heard it goes into major migraines, it goes into neck pain, into shoulder pain. Shed some light on it. Is this all true or not quite so true? What's your take on it? You do this for 20 years now.
Yes. There's a whole range of possibilities, but it can certainly go into severe migraines, neck pains. It can be very, very debilitating. I've seen some people who are in extreme pain really became disabled just from their TMJ-related issues. That's not usually the case, and not just because you lose a tooth or two doesn't mean that you are going to get TMJ. I've met many people with TMJ that have all their teeth, and I've met many people without teeth who have all sorts of TMJ problems. So it'll vary, but absolutely can certainly lead to it. So you'd like to the key is maintenance. The key is maintain what nature intended you to have and keep it healthy.
Sure.
That's the key. So the moment you start taking away bits and pieces of what nature intended you to have for optimal function, you're running the risk of breakdown in other parts of the system. And that's really evidence of breaking down, usually in the dentition. Something went wrong with the dentition. Could be missing teeth, could be crowns that were put on too tall, that now are triggering other problems, muscle problems, that then translate to TMJ-related problems. I don't want to overemphasize this.
The idea is that we don't, the idea is a missing tooth. A missing tooth definitely. One missing tooth will have the tendency to make other teeth getting out of shape, and you're eating and biting wrong. You get your whole jar out of wacko, which could potentially lead to other problems. That's not the only reason why you could have migraines and headaches, but it could be all one of it. And once you have those things, like with almost everything else, it's much more difficult to go back to a normal stage compared to keep preventing it in the first place, right?
Correct. You're absolutely correct. So the key to remember is there's a reason why we have X amount of teeth. And there's a reason why molars are designed the way they are and where they're placed. And why we have front teeth the way they are and why they're placed. The moment we lose one or more and we don't address it, doesn't mean that we're going to go to hell in the handbasket. But you begin the process of stressing other teeth, using other teeth in a way they weren't intended to, and their breakdown and their health then begins to deteriorate. You run the risk of that. Does it happen every time? No. But this is the path you potentially are going down.
Beautiful. Dr. Chavez, thank you very much for your informative answer here. Thank you very much.
You're very welcome.